In this case, we're looking at a frontal chest radiograph of a young child. The first thing that catches my eye is the presence of the characteristic steeple sign. This is indicative of narrowing in the trachea, where the normal shoulder of the air column has been replaced by an upturned V shape, suggesting a narrowing of the upper airway. This is a classic sign associated with croup, or acute laryngotracheobronchitis. Additionally, I'm seeing bilateral central peribronchial thickening and some parahilar infiltrate. Despite these findings, the lung volumes are well preserved, and there are no other abnormalities that stand out. If there's a history of viral illness, then croup is the most likely diagnosis. However, we also need to consider other possibilities like epiglottitis, which is more urgent and can require immediate airway management or perhaps ingestion of a caustic substance. Moving on to the lateral neck radiograph from the same patient, there's dilatation of the hypopharynx and narrowing of the subglottic trachea. These findings, again, are consistent with croup, and the prevertebral soft tissues appear normal. The epiglottis looks unremarkable, which helps rule out epiglottitis in this case. This further strengthens the diagnosis of croup, particularly in light of the radiographic findings. Given the radiological findings and clinical presentation, it's important to immediately consult with the pediatric team. If the history includes caustic substance ingestion, that would certainly complicate the picture and might lead to airway obstruction or inflammation mimicking croup. In an exam setting, you might be asked to differentiate between croup and epiglottitis on radiographs. Key points would include the steeple sign in croup and the thumb sign in epiglottitis, enlarged epiglottis on lateral view, as well as the absence of soft tissue swelling in croup. Next steps would include airway management and close monitoring in a hospital setting, particularly if there's suspicion of caustic substance ingestion. As always, if you're finding these breakdowns useful, make sure to subscribe to Radiology Made Easy. There's plenty more to learn, and I'll be with you every step of the way. See you in the next case.